Can you tell me the question numbers yesterday I have given for you? Can you tell me the question numbers yesterday I have given for you?
Fourteen.
14. This, what is your answer?
Two 0680.
Okay.
B.
B for Bombay is the correct answer.
Yes, sir.
Any other answers? What is doing here by the physician? They are removing the retained Kirschner wire was located within the distal phalanx. They are removing the wire from this location. Next question number
16.
16. 20553. What is your answers? What are your answers? B only, right?
20553.
Trigger
Yeah.
point injections, you need to look for the number of muscles: rhomboid major, minor, and levator. Next question number
19.
is here. See, when you are getting this type of big questions, try to read the code description first and then read the question. That is one of the easiest way. But anyway, what is the fracture the patient is having? Left proximal humerus fracture. Then what was doing by the physician here? Open treatment was doing by the physician here. Yes or no?
Yes.
Now read the code description 23615.
Open treatment of proximal humerus, surgical or anatomical neck fracture includes the internal fixation. When performed, include the repair or tuberosity when performed.
23616.
With
Open
proximal
treatment of proximal. Open treatment of proximal humeral, surgical or anatomical neck fracture includes internal fixation when performed, includes repair of tuberosity when performed with proximal humeral prosthetic replacement.
Okay. Now, prosthetic replacement is going on or not, you can check. If you see the fracture site was identified and fragments were mobilized, humeral head fragments removed. Once this was done, the stem was prepared up to a size of 10. A trial reduction was carried out. Trial stem and implant head sutures was kept in key positions for closure of tuberosities down to the shaft, including sutures through the shaft. The shaft was then prepared and injected. The implant was placed. Once the cement was hardened, the head was placed. A bone graft was placed around the area where the tuberosities gave excellent closure and average. The wound was thoroughly. Yes, tell me. ARC, what is your answer?
C.
A.
Why A, Sunil?
Sir, implant is prosthetic, na, sir.
Uh-huh.
That's why going to option A.
Implant replacement is going on. If you see code description 23616, what they are going to do? They are replacing the implant or they are placing the implant here.
Placing the implant.
Placing the implant. They are not replacing the implant. Just check. Yes or no?
Is this applicable for replacement only, sir?
Which one?
23616.
That is replacement only, right? Prosthetic
Okay.
material replacement. They are placing right now. Okay?
23615 is fine, sir.
23615. Next question number.
22.
Is 22. What are your answers?
D.
B, sir. B for Bombay.
B for Bombay. Can you read the code?
D for Delhi.
For Delhi, sir.
D for Delhi is the correct answer. C, 29824, that is claviculectomy. Yes or no? If you read 2, 3, 4, 5, 6, 7th line, the undersurface of the clavicle was noted to be quite prominent and a part of the impinging process means extra growth. They are not removing the clavicle. They are doing debridement here. Understanding? They are not removing the clavicle. If you see 29824, what is it? Distal claviculectomy.
Yeah, okay, sir.
Okay. Next question number
24.
24.
24.
72-year-old female sustained left radius fracture, okay, resulting in volar angulation, radial shortening and loss of radio-ulnar inclination. A general anesthesia was administered. The make incision was opened. A series of osteotomes were utilized to open the fracture site, and the normal distal radial architecture was restored. The pipelate was placed on the distal radius utilizing a combination of 2 and 1/8 point screws and 13 pins for the distal segment. Fragments were secured into the distal. Yes, it's an open treatment. Yes or no? This terminology is open treatment.
Yes, open.
Open treatment. But what is the site here? Malunion. What is the site? Malunion.
Malunion.
And it is an acute fracture. They are repairing the malunion site. Now give me the code. What is the code?
D. D for Delhi.
Yeah, I think yes, sir.
A. Okay, can you read the code description 25400?
Repair of non-union or malunion radius or ulna without graft.
Okay.
Compressor technique.
Okay. 25609.
Open treatment of distal radius intraarticular
No.
fracture or epiphyseal separation with
No. No need.
internal fixation.
No need to read. That's go for option B 25405.
Autograph for that time.
With autograph.
Yeah.
Here is there any graft used? No. Then A
No.
is the correct answer. Shobha, here this is not an acute treatment. Here the fracture is malunion or non-union. Always keep in mind. Understood, Shobha?
Yes, sir. Yes.
Okay. Next one. Question number. Next question number.
3030.
Yes. How many segments are there? You can tell me first of all. How many segments are there in the question?
3
6.
levels, sir.
C2 1, C3 1, C4 1, C5, C6.
4 segments.
4 segments are there. Yes sir. No? Total 4 segments are there.
Yes, sir.
4 segments comes under 22845 or 846. You can check and tell me. 4 segments. See, each one is considered as one segment. C2, C3, C4, C5, C6.
846, sir. 22846.
Now, rule out option A and C. Now, what are you having the options? B and D.
B is the answer, sir.
Now, you can check 20930. See, this is the best way to rule out the options. 20930,931 is for graft. What is the graft used here? Morselized yellow graft. Go and read the code description 930931. Where it is having morselized yellow graft, you can check. 20930,931.
Allograft morcel 209930.
Okay.
Allograft morselized
Okay.
or placement of osteo. 931 is allograft structural for spine surgery only.
Oh.
Separately in addition to core primary procedures.
Morselized autograft is used in B option. Yes or no?
Answer B.
See, it seems to be there are 5 to 6 options. This is the best way. How you can come like this means practice. When you are practicing, okay, this type of question I got. No need to look for each and every option. I can go for instrumentation code. I can go for graft code so that I can rule out the remaining options. This comes through practice. Understood everyone? Otherwise what you will do is you will search for each and every option. No need to look for 63081. No need to look for 22554. Just only cross check what is 22548. But understood everyone what I am doing? See, it will come only through practice. You just write down there what are the points you need to look for. Write down there. First one, Location on spine. Location on spine. Here it is cervical. Next one is approach. 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 Next one is approach. Next one is segments. Next, spinal instrumentation. Next, bone graft. These 4 or 5 points you can keep in mind. You will rule out options easily. What are the points? Location on spine, approach. Next one is
Segments.
Segments.
next one is
Spinal instrumentation.
spinal instrumentation. Is that clear? Next question number
32.
32. Yes, tell me what is going on. Meninectomy is going on. Medial and lateral or only medial?
Only medial, sir. Only medial compartment.
Then what will be your answer? A or B? D?
29881 D.
D is the
D.
answer. D for Delhi is the answer. Everyone? Any other answers? Next question number. Next question number.
Over, sir. Completed.
Finished.
After doing all these 7 questions, how you are feeling when you are doing musculoskeletal? Is that difficult? Or when we practice for 2 more times, then it will be easy? Any rules are there? Or purely based on
Sir, can you explain the 24th question now?
question number 24?
Sir, I need yes, sir.
See, here it is not an acute fracture. Understood? This is not an acute fracture. Here it is malunion. Malunion or
But
not?
it not mentioned, sir.
Where? Third row.
Not mentioned in question.
Third row. The capsule was opened in a T fashion and the malunion site was identified.
Okay, sir.
Okay. See, if you do the questions 1 or twice in musculo, it will be very easy. Only the rules in surgery section is only in integumentary system and little bit endoscopy rules in digestive system. Apart from that, are you facing any rules? No, nothing. Here in musculoskeletal system, anatomy, type of fracture, type of treatment, whether they are using bone graft or not, they are using external fixation or not. Sometimes if there is an excision of tumors, then see the deepest layer and diameter. I hope it's understood, everyone. One more
Sir.
and last question.
Thank you, sir.
Yes. Yes, please.
Sir, question number 24, how it is open treatment, sir?
How it is? Open treatment.
Open.
See, lot of incisions are going on. They are placing screws. Yes or no? How can you insert a
Okay,
screw?
in terminology,
How can you?
in key terms there are nails and rods, so I'm asking.
Rods and screws means what? They need to open, right?
Yes.
See, without any instrumentation means closer treatment. The word traction means they will apply force directly to the limb. Okay. By percutaneous treatment means by placing pins through the skin with the help of guidance. Guidance is the key term. That skeletal fixation is done with the help of, that means treatment of fracture site is done with the help of pins under guidance, that is percutaneous. Next, open means by making an incision or intramedullary nail, rods, screws. This comes under open. Do one more question in front of me.
Hello.
Yes.
Sir, in question number 19, the answer is A or B, C, sir.
See, start doing 23, everyone. Question number 19. C. 23615.
Sir, I got it A, sir. Why? Because the implant is on head, sir.
Implant is done.
So replacement of head, sir.
Implant is going on. Prosthetic replacement.
Yes, sir.
Prosthetic replacement.
Yes, sir.
The code description 23615.
So prosthetic replacement.
Replacement means they are already there is the implant. They will replace it. Remove
Yes,
and
sir.
they will again replace it that instrument. Then we will code that code. Replacement.
Understood what he's saying? For example,
Yes, sir. But the factor of repair on included the prosthetic treatment means
listen.
implant on head and the tuberosities, sir.
Listen. 1 second. First,
Yes.
shoulder bone naturally. That what the physician have done, they removed that natural one and they placed an artificial one. That is nothing but prosthetic implant. Understood?
Yes, sir.
Now what they are doing right now, they are removing the prosthetic one and again they are placing another one. That is prosthetic replacement. Is that clear?
Okay, sir.
Okay, now read
Yes,
the
sir.
question. You will understand whether prosthetic replacement is going on or the bone fragments they are removing and they are placing implant. You need to know. Okay.
Okay, sir.
Question number 23. Do one more question in front of me. Question number 23. Practice this paper for at least twice, thrice. All are important questions.
D is the answer. D for Delhi.
Everyone the same? Any other answers?
No, sir. Yes, fine.
Like this, we have to do musculoskeletal system questions. Understood, everyone? Next, make heading respiratory system. Respiratory system. Respiratory system. Page number 211. Page number 211. Are you there, everyone? Page number 211.
Yes, sir.
Okay. Now, try to see how many sinuses are there in the diagrammatic representation. 4 sinuses. What are they? Frontal.
Frontal, ethmoid, sphenoid, maxillary.
Now, these are bilateral sinuses. Bilateral sinuses. Always keep in mind. Bilateral sinuses. Frontal, ethmoid, sphenoid, and maxillary. There are 4 sinuses which are located bilaterally. Next one, try to see the diagrammatic representation and try to recall the diagrammatic representation. Right lung 3 lobes, left lung 2 lobes, space, mediastinum, below the muzzle, diaphragm, bronchi, bronchioles, alveoli, trachea, larynx, epiglottis, nose, nasal cavity, nasopharynx. Is there terminology in terms of nose is naso, rhino, lungs, pulmono, pneumo. Okay, now come to the quotes. First one, 30140, common procedure done in the outpatient setting or SDS. 30140, submucosal resection of turbinates, the middle portion of the nose. 30140, try to mark in your book. Turbinates, you can see the code description. Next, 30520, again another common procedure done in the outpatient setting. 30520, septoplasty, which divides the nose into two. 30520. Next, 30801, 802, destruction, ablation or destruction, both are same. 30801 and 802. Next, come to the code description, page number 216, and you can see the turbinates. You can see in the diagrammatic representation the turbinates. You can see in the diagrammatic representation of the turbinates, middle, inferior, superior. Middle, inferior, superior. Can you see the turbinates?
Yes, sir.
Okay. Now that they are removing there, now see the codes, mark the codes. Epistaxis means nose bleeding. 30901, 903, 904, 906. 30901 to 906. Nose bleeding, that is nothing but epistaxis. One is the anterior side, another one is posterior side, based on the encounter type, that is initial or subsequent. Next one, come to the codes 31231. How many sinuses are there? There are 4 sinuses. You can see the diagnostic procedure 31231. Now write down there one point. 312372, 312372, 31241, 31232, 31241, 2312, 241 are the common procedures. 2372, 241 are the common procedures performed on all the sinuses. Performed on all the sinuses. Common procedures performed on all the sinuses. Now, whereas 31254 underline the key term ethmoid sinus. 31254 underline the key term ethmoid sinus. Three one two five six underline the key term maxillary sinus. 31256 underline the key term maxillary sinus. Three one two seven six underline the key term frontal sinus. 31276 underline the key term frontal sinus. Next, make heading in your book laryngoscopy. Laryngoscopy. 3 types. Laryngoscopy. 3 types. First one, direct. Direct. Next, indirect. Indirect. Third one, flexible. Direct, indirect. Third one, flexible. Direct, indirect. Third one, flexible. Next point, indirect laryngoscopy. Indirect laryngoscopy. Visual examination of indirect laryngoscopy. Visual examination of trachea. Visual examination of trachea. visual examination of trachea, and operating microscope is included. Visual examination of trachea and operating microscope is included. You can see the code 31505. What is the type of laryngoscopy in the code description? 31505. 31505. What is the type of laryngoscopy in the question?
Indirect.
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 Now 31515.
Direct.
Direct. 31575. 31575.
Flexible.
Next one. Come to bronchoscopy codes. 31622. Underline the key term fluoroscopy. In bronchoscopy, what is the guidance included? Fluoroscopy. Why? Because by using bronchoscopy, n number of procedures a physician can perform. Now, how you will read the code description? For example, if I say 31646, 31646, how you will read that code description? 31646.
Bronchoscopy, rigid or flexible, including fluoroscopy guidance when performed, diagnostic with cell washing when performed, with therapeutic aspiration of tracheobronchial 3, subsequent same hospital stay.
Now, what is the meaning of this one? If anyone can tell me. If you know anatomy and terminology, you can understand it. Trachea, bronchus. Where the trachea modified to bronchus, that is, you can say it as, assume it as tree. From that, what they are doing, aspiration. That means they are drawing the fluid. The patient is in the hospital. Subsequent means second time. Understood? This is the way you need to understand the code description with the anatomy. Next one, come to VATS. Can you tell me what are the body parts present in thoracic region? What are the body parts present in thoracic region? Come to the code description 32601. What are the body parts present in thoracic region? Lungs. Inside the lung, the space mediastinum. In that mediastinum, you can find out pericardial sac. Lungs surrounding the membrane, what we call it as pleura. Yes, sir. These are all the parts of thoracic region. Try to keep that points in mind. See the question number 15. 1-5. Question number 15. 1. Respiratory system. Question number 15. completed. A patient's nose was hit with a baseball during a high school baseball game. At that time, reconstruction was performed with local craft. Patient returns now as an adult, discontent with the bony prominence along the bony pyramid of flat look of the tip of the nose. He underwent major repair with osteotomies and nasal tip work. What is your answer?
C, sir, on
303.
30450. C.
C is the correct
450.
revision. Yes or no? 30450. Okay. Next question number 20. 20. Make it fast. We'll practice. Try to find out the key term. That's it.
Answer B, sir, Bombay. 30903. What you said, Sunil? 3090? 30903, sir.
Can you read the code description?
906.
Subsequent.
309003.
905, sir.
See these many answers. Very simple question. Try to focus. Emergency room with severe epistaxis. Common occurrence. Winter. Third time this week. Posterior. Posterior, not anterior. Understood? Then this is the third time. That means initial visit or subsequent visits?
Subsequent.
Subsequent visits. Now what is the code,
9.
Mr. Sunil?
30906.
Then why you coded 30903? Slowly you can. Everyone,
I see
30906. 30906, everyone?
Yes, sir.
Okay.
Yes.
Yes, sir.
Question number 28. 28.
Answer is C, sir.
Which question, Mohan?
28.
D for Delhi.
Okay. Shobha, you
D for Delhi, sir.
31256.
Sir, what is antrostomy?
Sinus ostomy. Artificial opening. Artificial opening. What you asked?
Antrostomy.
Antrostomy, right?
Yes.
Enlarging or opening of the maxillary sinus. Enlarging or opening of the maxillary sinus. What we call it as antrostomy.
Okay, sir.
Everyone, 31267. Okay, now take questions to home. Take the questions to home. Practice at home. Tomorrow we will discuss the remaining questions. Question number 50. Question number 50.
Sir, what is the answer for 28 question?
D for Delhi. Everyone the same or different answers? I need to discuss that question. Next, question number.
Yes, sir. D is the answer.
B is the answer for that. D is the answer. D for Delhi, right?
D for Delhi, sir.
D, sir.
Okay, okay. Now take the questions. Practice these questions at home. Means in the evening time. Question number 50. Question number 50. 49. 49. 49. 47. 44. 44. But how many questions total? How many is it? 4?
Oh,
Okay. 37. 37. 33. And last question 32. 32. These 7 questions. These 7 questions. Yeah. Make heading modifiers. If I complete modifiers for you, then tomorrow I will. Tomorrow also half of the day will go for modifiers. Then cardiovascular system at the last. Make heading modifiers. Modifiers. Now write down. 22. What are the modifiers we are going to discuss? 22. Did I set modifiers? Did I completed modifiers for you? No, right?
No,
No,
sir.
sir.
No, okay.
No, sir.
Take modifiers. First one, 22, 23, 24, 25, 26. These are not numbers, modifiers, okay? 26, 27, 27, 47, 47, 50, 51, 52, 53, 57, 58, 59, 62, 73, 74, 76, 77, 80, 91. Total how many modifiers? 95, 91, 95. Total how many modifiers? Total
Total 22.
22. Examination oriented. See, those are interview, whatever it may be, you can use. But for examination, just write down only few modifiers, particular modifiers regarding examination. 78, 58, 62, 78, 58, 62, 25, 91, 50, 51, 59. These are the common modifiers that you will get in the examination point of view. Understood? Total how many? Examination.
Can you repeat it again, sir?
8, sir.
Can
8, sir.
anyone repeat those modifiers?
78, 58, 62, 25, 91, 50, 51, 59.
Yeah, thank you.
Okay. These are the examination oriented, but for interview oriented, above modifiers, you just go through it when you are going for the interview. Now, what is meant by modifier? Anyone in the class? What is meant by modifier? What is meant by modifiers? Anyone in the class? See, few of you are coders, right? Right. A modifier means it indicate that a service or procedure that has been performed has altered due to some specific circumstances. has altered due to some specific circumstances. Due to some specific circumstances. But there is no change in the definition of code. There is no change in the definition of the code. Modifiers are used for effectively payment to physicians. Effectively payment for physicians. Now listen, based on the definition, are we changing the code description by adding the modifier?
No.
No.
Why we are adding modifier to a code? A procedure has been altered due to some circumstances. To indicate what it is altered, we are denoting with the modifier. Understood? For example, generally anesthesia codes used by anesthetologist, but there is no anesthetologist. Who is giving anesthesia? Surgeon. Due to some specific circumstances, the service has been provided is altered. By whom? Surgeon. What is the modifier? 47 modifier for effectively payment. Understood everyone? Now write down 1 modifier. First modifier 22. 22 modifier. 22 modifier. I will complete for this today. Increased procedural time. Increased procedural time. Increased procedural time. Next point. It is used along with surgery codes. It is used along with surgery codes. Key terms are time, comma, extra time, additional time. Key terms are time, extra time, comma, additional time. Now listen the modifier. For example, a physician is scheduled for, you can say, laparoscopic cholecystectomy. What is the procedure scheduled for that patient? Laparoscopic cholecystectomy. Understood everyone? Generally, the procedure takes, for example, you can say 60 minutes or 70 minutes maximum time. But due to patient's morbid obesity, the procedure is taking for almost 2.5 hours. Almost 2.5 hours. That means in his documentation to perform cholecystectomy, extra time, additional time, or extra 1 hour I took to perform this procedure along with the CPT code. What is the modifier we need to use?
22.
22. Understood everyone? Increased procedural time. Increased procedural time. What are the key terms? Time, additional time, extra time. Those are the key terms. Okay. Next, one more modifier, 23. Unusual anesthesia. Unusual anesthesia. Unusual anesthesia. Unusual anesthesia. It is used only along with anesthesia codes. It is used only along with anesthesia codes. Write down. Generally, a procedure which doesn't require anesthesia. A procedure which doesn't require anesthesia. Generally, a procedure which doesn't require anesthesia. A procedure which doesn't require anesthesia. Based on the circumstances. Based on the circumstances. Physician is inducing anesthesia. Physician is inducing anesthesia and performing the procedure. And performing the procedure. See, unusual. The term itself indicates unusual means no need. Yes sir? No? Unusual means what? No need. If you see the synonym,
Yes.
for unusual means no need. Yes sir? No?
No need.
But
Yes, sir.
no need, then also they are giving anesthesia to perform the procedure. At that time, what is the modifier? 23. To which code we need to quote? Anesthesia codes. Understood?
Anesthesia.
Practice those questions. Tomorrow we will complete modifiers and we will start with cardiovascular. Okay, the last session in surgery. Thank you everyone. See you tomorrow.
Mohan, I have one question. That day I had asked you, I was googling it about the split share visit. I didn't get any modifier or any information. Can you help in that?
Split services. 27 modifier.
Yes.
27 modifier.
20?
27. 27. Okay.
To the NM.
Multiple outpatient visits for physicians. You can check. Okay.
Okay, thank you.
Okay.
And what about the ENM you will be taking, no? MDM table?
Yes, of course. By
Okay.
tomorrow, cardiovascular. Day after tomorrow, if I completed cardiovascular, then I will teach you the MDM table. We will close the session. Okay.
Okay, thank you. Thank you.